Morning to all, and we all know very well Dr. Jagannathan. There's no need to introduce him, but as you know, as we all know that Dr. K. Jagannathan is the President, Board of Unani, Siddha and SowaRigpa, National Commission for Indian System of Medicine, NCISM, New Delhi. Professor Dr. K. Jagannathan is MD, Siddha, PhD, and then currently President of Board of Unani, Siddha and SowaRigpa at NCISM. He a long experience of professional career. He has served as the Vice Principal and Principal of Sandigiri Siddha Medical College, Tiruvananthapuram. Then Kerala. He has been a member of number of committees and held a number of positions, including council member. Travancore Cochin Medical Council for India System of Medicine, Government of Kerala, member, Regional Ayurveda COVID-19 Response Cell, Department of Ayush, Government of Kerala, member, Siddha Committee for Drafting MSR for Clinical Establishment, Regulation, Registration and Regulation Act 2018, Directorate of ISM, Government of Kerala, member, Academic Council, Kerala University of Health Sciences. And for SowaRigpa, he is an architect, one of the architects of SowaRigpa curriculum, then MSc, MSR, rules, regulations, and guidelines, and all these things. So we all know Dr. Jagannathan very well, so there's no need to very broad introduction to him. So I would request Dr. Jagannathan to start his lecture. Thank you very much.
Thank you. Respected chairperson of this session, Dr. Dorji Damdruji, the Dean, SowaRigpa Medical College and Hospital, Varanasi. Then all the delegates. Good morning, one and all. Then are you ready to hear my presentation? Yes. Do you feel any sleepy? No? Okay. My presentation is focused on a role of NCISM in upgrading SowaRigpa medical education. National Commission for Indian System of Medicine, it is, the head office is at New Delhi. Actually, National Commission for Indian System of Medicine Act 2020, this act, the Parliament got the assent of Honorable the President of India on 20th of September 2020. And this act has been implemented, came to in force from 21st September 2020. If you see the composition of National Commission of Indian System of Medicine, this commission is composed of one chairperson, Vaidya Jain Dev Pujari sir. Then totally 15 ex officio members are there, including 4 presidents. Then 23 part-time members, and there is an advisory council for NCISM. They will give advices and suggestions in academic aspect and regarding the medical registration, ethics, and medical assessment and rating. In all areas, they will give advices. You see, under the commission, under the common shelter of the commission, 4 autonomous boards are functioning. Board of Ayurveda, Board of Unani, Siddha and SowaRigpa, Medical Assessment and Rating Board for Indian System of Medicine, and Board of Ethics and Registration for Indian System of Medicine. Board of Ayurveda, it is purely the regulatory body of Ayurveda medical education. It is headed by Dr. B.S. Prasad. Then Board of Unani Siddha and Sowa-Rigpa, it is headed by me. It is also a regulatory body of medical education. Both Board of Ayurveda and the Board of Unani Siddha and Sowa-Rigpa, these two boards are regulatory bodies. We are all the policy makers of medical education. Then Medical Assessment and Rating Board for Indian Institute of Medicine. Actually, this particular board is looking after the annual assessment, inspection, assessment, and this year onwards they are looking after rating of institutions, rating of ISM medical institutions. It is headed by Dr. Raghuram Bhatta. Then Board of Ethics and Registration for ISM. This board is looking after the ethics part of the practitioners and registration of the practitioners. It is headed by Professor Rakesh Sharma sir. So even though 4 different boards are there under the commission, we are working together for the betterment of Indian system of medicine. Then how many medical systems are there in under ISM? Anybody? Indian system of medicine. I am not talking about Ayush medical system, because NCISM is pertaining to ISM systems only. What are all the systems coming under ISM? Yes, tell me. Ayurveda, Siddha, Unani, SowaRigpa. Any more systems coming under ISM? No. Only 4 systems. Indian system of medicine means 4 medical systems, traditional medical systems: Ayurveda, Siddha, Unani, and SowaRigpa. When we look at the functions of Board of Unani, Siddha, and SowaRigpa, because this particular board is directly connecting with you. Determination of standards of education at all levels. At all level means at undergraduate level, postgraduate level, and super specialty level. In SowaRigpa, we are conducting only undergraduate course. In future, very near future, we are going to think about the commencement of PG courses also. So I will constitute committee next year, and we will discuss on that. We have to identify in which area we have to start the PG. So next year I will initiate that work. Before that, I want to stabilize all undergraduate medical institutions in SowaRigpa. First, we have to stabilize, and we have to establish all facilities in our existing institutions. Then develop competency-based dynamic curriculum. In SowaRigpa also, we developed for first professional BSRMS and the second professional BSRMS in a very minor form of a competency-based curriculum. It is not like that of Ayurveda, Siddha, and Unani. It is very, very extensive. We simplified that concept, and we made a different simplified format. Anyhow, in future, we are going for an extensive format of a competency-based dynamic curriculum. Then determine the minimum requirements and standards for conducting courses and examinations. It is also a prime function of our board. Then determine standards and norms for infrastructure, faculty, and quality of education and research. This is nothing but MES, minimum essential standards. Then specify norms for compulsory annual disclosure electronically or otherwise, but in SowaRigpa they are not submitting electronically, and now they are doing manually. In due course of time, SowaRigpa also has to submit annual disclosure electronically. Then facilitate development and training of faculty members. Already we have initiated. From next year onwards, NCISM will be focused on faculty development program. Every teaching faculties of Ayurveda, Siddha, Unani, SowaRigpa will be given orientation and training on education technology. So then only it will be very easy for the teaching faculties to follow and teach the competency-based course curriculum and syllabus. Then facilitate research programs. Already in the morning session itself, I told RIC, establishment of RIC is mandatory, even in SowaRigpa colleges also, research and innovation cell. So this particular cell will look after the research activities of the SowaRigpa medical institutions. Then grant recognition to medical qualification, because SowaRigpa degree will be recognized only by BUSS. That is very essential for your state registration. So these are all the main functionaries of BUSS. Then how many of you visited NCISM website? Raise your hands. Only few. Out of 100, 150 delegates, only 10 or 20 people visited. But you have to visit NCISM website regularly, because we are updating all current events. Then you can able to understand what are all the things are going around in ISM medical systems, okay, particularly in the academic side. This is NCISM site. Just I took a screenshot of the website. Then now we have developed a very big online platform that is called LMS, Learning Management System, because from 21 admission onwards, they are pursuing elective subjects only through this online platform. Then right now we are maintaining around 14 portals. Then education life cycle management system also there, because the students of Ayurveda, Siddha, Unani, and in future in SowaRigpa also will be given unique Ayush ID, so that through this education life cycle management system we could able to track the student till their last. So everything will be updated in that particular area, education life cycle management system. This is something about the MSc, minimum National Commission for Indian System of Medicine, minimum standards of undergraduate SowaRigpa education regulations 2020. It has been published on November 16th, 2022. We brought, already I told, we brought so many reforms in SowaRigpa. I will explain few important reforms what we have brought in SowaRigpa medical education. In the morning session, I told from 2021 onwards, we are admitting the students only through entrance test. That entrance test is directly conducted by NCISM in the name of NCISM NEET SowaRigpa UG. We designated this institution to conduct this particular entrance test every year. Then we constituted SRCCC, SowaRigpa Central Counseling Committee at NCISM. The counseling and seat allotment is decided by only by this committee. After conducting examination, then based on the merit list, the SRCC will allot the students to individual SowaRigpa college. Then you know a BSRMS course, 5.5 years course, then 4.5 year main course, and 1 year internship. Because many practitioners are here, so that students, I need not explain all these things, but for practitioners I am explaining. 3 professional sessions. First professional, second professional, and third professional. Each professional session will be having 18 months of duration. Previously, 1 year, and 1.5 year. Now we changed. Then academic session will start with the induction program. For this induction program, we published the transitional curriculum also. Based on the curriculum, they are conducting an induction program. Actually, we implemented from 2021 onwards in Ayurveda, Siddha, Unani, and SowaRigpa. We received many positive comments from the students and the teaching faculties across the country, because it's a very successful initiative initiated by NCISM. The purpose of the induction program that has been prescribed for 90 hours, 15 days program. so that the newly joined student, because we are getting the students from the diversified area, diversified heritage culture. So some students will be from the science background and some students from the Buddhist studies. So it's likewise, so that transitional period is very much needed, because all of a sudden they are exposing to first professional subjects, means it will be very difficult for them. They cannot adjust with the teaching and training all of a sudden. So we made 15 days of induction program. During this program, the student can be able to understand about their campus, then what are the subjects they are going to study, then what are the facilities are available in that institution, then what are all the rules and regulations to be adopted in that particular institution. Then they will be given some motivational speech also. Then they will be given some hands-on training. Then particularly how to effectively use IT tools, then basic life support, then personality development. So all these exercise will be given during induction period. So during this 15 days of transition period, the student will know everything. So after this induction period, they will exposed to the first professional subjects. Then before induction period and after induction program, we conduct a test, a pre-test and a post-test. Then after 15 days, they will be updated with many things. Then this is the important reform what we brought in UG courses, 1:2. Previously, if you look at the previous curriculum and syllabus, the prime focus will be on theory part. Suppose 100 hours are allotted for theory, means only 20 hours or 15 hours or 30 hours will be allotted for practicals. But NCISM is very keen on skill development, because the ultimate aim of a UG course to produce the physicians. So physicians should be trained very properly. So we reversed that ratio. Lecture hours, one part means 2 part of practical training. That is called non-lecture hours. Again, non-lecture hours, it is bifurcated into 2 categories. One is 70% of the non-lecture hours will be devoted for practical training, and 30% of the non-lecture hours will be devoted for activity-oriented teaching and training. For example, group discussion, role play, then flipped classrooms. So we adopted nearly in Ayurveda, Siddha and Unani, what we made, we introduced around 55 TL methods, teaching learning methods for non-lecture hours. In SowaRigpa also we included, then we included around 30 TL methods, I think, in SowaRigpa. So but now in PG, Ayurveda, Siddha and Unani, what we made, we introduced a new format, 1:2:3. UG 1:2, PG 1:2:3. That is one portion for theory. For the same theory classes, this PG student has to undergo for 2 hours of practical training, and for the same theory, he has to undergo for experiential learning for 3 hours. So likewise we made in Ayurveda, Siddha and Unani. In SowaRigpa also we will implement the same. Then if you see the timetable of BSRMS course, we allotted 1 hour, minimum 1 hour per week for library and physical education. I hope this institution also following the same thing. And for recreation, we are allotting 1 hour per month, because as far as NCISM is concerned, we are more focused on the physical and mental health of the students. Then why we are allotting for library hours means, actually the class hours starts from 9 o'clock, it will be going up to 5 o'clock. Then lunch break, it is for only 1 hour. So the students is tightly engaged in the class hours. So they could not able to go to the library also. So we found that lacuna in ISM sector. So we introduced library hours also. Physical education, it is for improving the physical condition, and recreation for the promotion of mental health. So we are addressing these areas also. Then if you see the subjects, there are 21 subjects are there. And then actually this is the first time we included medical astrology as a subject. Medical astrology is the strongest area in Ayurveda Siddha also, but in Ayurveda Siddha we did not include medical astrology. But here SowaRigpa we included. Actually this initiative has been appreciated by Our Holiness Dalai Lama when we visited Holiness at New Delhi. Then apart from the 21 subjects, we included oral test and concept mapping also, because this is the very strongest area in SowaRigpa. Because we are giving much importance for Chatushtandra related the concepts and the basic principles. So we are in the syllabus, in the regulation itself, we are giving priority for oral test and the concept mapping. Then for the first time we have given the subject codes also. It is for documentation purpose at university level. Then this is the screenshot of our curriculum. But in SowaRigpa, in each subject we provide 20 to 30 or 40 pages of curriculum, but in Siddha, Ayurveda and Unani, it goes beyond 500 pages, 600 pages. Now I am preparing PG curriculum. It crossed 1,000 pages. It was very extensive. But here it is a very simplified form, but in very near future we are going for extensive setup. Here you see in the table, it is a QR code embedded so that anybody can download from our website. Then the second column, the first row you see chapter 1, indigenous medical knowledge during prehistoric period. So K and A. K means it is knowledge level, because the 3 domains are there, domains of learning. What are they? Anybody having idea? 3 important domains of learning. Knowledge, skill and attitude. These 3 things are called the domains of learning. This particular chapter 1 will address 2 domains, knowledge domain and affective domain. Affective domain, it is otherwise known as attitude. Knowledge is otherwise known as cognitive. Then skill, otherwise known as psychomotor. Totally 3 domains. This chapter addresses 2 domains. Knowledge, explain the student at the end of this chapter, the student can able to explain indigenous medical knowledge during prehistoric period. Then at the end of this chapter, student can recognize the importance of indigenous medical knowledge. These are all the expected outcome of the first chapter. So similarly, we work for every chapter. We are defining the expected outcome. Without that planning, we are publishing the curriculum means there is no meaning at all. Objective should be there and outcome should be there. So such a way we made the SowaRigpa curriculum. Then second column you see lecture or non-lecture hours. For lecture you see totally 6 hours. Lecture hour totally in chapter 1 4 hours, then non-lecture hour 2 hours. This is introductory part, so there is no scope for any practical training here. So if you see the entire table, you can able to see the 1:2 ratio. Lecture hour 1 part, non-lecture hour 2 part. Then you see the third column, how the first chapter will be taught. The teacher will adopt a lecture TL methods like a lecture, group discussion, self-directed learning. So we are specifying which particular TL method should be employed to teach that particular content. Likewise, we prepared. Very soon we are going to develop the curriculum for third professional BSRMS. I will initiate that work in the month of March or April. Then there are 8 teaching departments are there. Previously, how many departments were there? Previously, only 6. Now it is increased to 8. Because I found one lacuna in the teaching department, because in the second professional, there is no direct teaching department for the second professional subjects. So I increased the teaching departments into 8. Because the teaching departments are very, very essential. When we talk about the PG course, this is very important. We introduced a new teaching department in the name of clinical psychology and toxicology, and we combined surgery with external therapy, and pediatrics and gynecology and general medicine. There are 4 important clinical departments are there. Then online elective courses. Now, actually this is the first time elective courses in ISM sector have been developed. The purpose is the Apex committee, Apex council will publish some syllabus, and students, they are bound to work only on the prescribed syllabus. We are not thinking about the capacity of the student or the aptitude of the student. So then we decided to provide some elective courses also. Based on their interest, they can choose their topic. Now around 35 elective courses are available now. Actually, we are planning for 70 courses. Very near future, we are going to add more number of electives. Now 35 elective courses are there for undergraduate students. In future, we are going to include nanosciences, then geoinformatics, then medical anthropology, then such things we are going to include. So it's a very good opportunity for the undergraduate students to choose the elective subjects based on their interest, because updation of current knowledge and technology is very, very much needed for graduates, because they are going to, in future, they are going to work in foreign countries also. They have to fit to that particular environment. So they should be updated with current knowledge and technology. Only for that purpose. Then another main intention is we have to promote the multidisciplinary aptitude among the students. This is the main purpose. Then if you go through your regulation, MSc regulation, regulation number 9, it speaks about MASTD, modern advances and scientific and technological developments. Actually, we made a provision for Sowa-Rigpa, supplementation of modern advances, scientific and technological developments in future. Because we are going to constitute committee, we have to include all sort of MASTD in our curriculum. This is also very much important, because for the research purpose, for the innovation and research, this thing is very much needed. So once you incorporate any modern advances in your curriculum, when it is retained in your curriculum for 5 years, based on our regulation, it will automatically become a part of SowaRigpa. So such a way we made regulation. Then this is something about early clinical exposure. In previous CCIM curriculum, the clinical training will start only from 3rd year. Now it is not like that. The clinical training will start from first profession itself. So that is called the early clinical exposure. So that the advantage is the student will be getting around 900 additional hours of clinical training. Because already I told the main difference between UG and PG, UG we are going to produce the physicians, but whereas in PG we are going to produce the specialists. So for physicians, the clinical exposure is very much needed. So we started from first professional onwards. Then for the first time we are conducting formative assessment also. That is right from 2021 onwards. Formative assessment in the sense, 18 months of professional session is divided into 3 terms. First term, second term, and at the end of 18 months, the student will appear for university examination. Totally 3 terms. In each term, we put a mandatory requirement of conducting 3 periodical examination. So totally in each professional session, the student has to undergo for 9 periodical examination and 2 term test, first term test, second term test. So the advantage is, if at all you find any lacuna in any student, there is a chance for improvisation. So at the end of the professional session, we could able to bring all students at the same competency level. This is the main intention behind. Then summative assessment is nothing but it is examination conducted by the university at the end of 18 months. Only 3 summative assessments are there at the end of first professional, at the end of second professional, and at the end of third professional. But every professional session, the student has to undergo for 9 periodical examination and 2 term tests. So these are all the reforms what we made in SowaRigpa. Then from 21 onwards, we used to circulate the academic calendar for each and every batch. Because we did the same in Ayurveda, Siddha and Unani. Actually, before 2021, what had happened, the college will conduct course of their own. When they start, when the course will end, we don't know. Then university also, now 95 universities are conducting Ayush courses. Universities will be conducting the university examination at a different period. So 21 onwards, we regularized everything. All universities are conducting the university examination, Ayurveda, Siddha and Unani and SowaRigpa at the same time. Then we regularized academic events also. When to commence the course, when to conduct periodical examination, when to conduct a term test, when to conduct the university examination, when to provide the holidays. Everything is explained in the academic calendar, so that we could able to regulate the academic events across the country very properly in Ayurveda, Siddha, Unani and SowaRigpa. Then this is something about the MES. Previously, we have gone through minimum standards of education, undergraduate education. It is totally different. This is minimum essential standards. Actually, before 2023, MSR regulation was there. Minimum standard requirements. What had happened? If you put minimum standard requirement means, the college will adjust the infrastructure and facilities within the prescribed norms, minimum standards. So they did not think about the higher standards or maximum standards. They will be doing all the things within the limitations. So we have to overcome that issue. So we put a minimum essential standard. These standards they have to adopt. These standards are very, very essential, minimum essential standards. Then what we did, over and above the minimum standards, we fixed some criteria and we put all these criteria for rating purpose. In next year onwards, SowaRigpa colleges also will be rated. Because already we made a rating criteria, it is attached with MES regulations. So based on that assessment criteria, SowaRigpa colleges will be assessed. Then we will put the rating of the institution on NCISM portal. Then based on that, the students will opt the colleges. So these are all the things why NCISM has been initiated means we have to motivate the college to grow towards higher standards. We cannot stay with the minimum standards. No compromise at all. Then regarding college, already I told previously only one slab was there regarding student intake capacity, that is 15 intake capacity. Now we made two slabs, 15 intake capacity and 30 students intake capacity. Then every institution has to establish a IT support, IT cell also. It is applicable for SowaRigpa also, because we are conducting elective courses. Then moreover, in Ayurveda Siddha and Unani, we implemented digital library. Then without IT infra, then we insisted for smart classes in Ayurveda Siddha and Unani. Then we already launched the online platform also. So IT infrastructure is very much needed in all ISM medical education sector. Then medical education unit, it is also a mandatory requirement in all institutions, including SowaRigpa. Through this medical education unit, we are going to train all teaching faculties on education technology. Then a research facility, already I told, every college has to establish a research innovation cell. That RIC is that is needed for research, innovation, then what to say, entrepreneurship development, then IPR. IPR, you know, intellectual patent right. And then research publications. So this RIC will coordinate all these activities. Then herbal garden, previously it was maintained with only 40 species, I think. Now it is increased to 70 species. Study on herbal medicine is also very essential for SowaRigpa. So we increased the number of species. Then in college side, it's a mandatory requirement of establishment of a language laboratory. Language laboratory, why it is essential? To provide a training in phonetics, then language the improvement, I mean Tibetan language or Boti language. Then that unit should be provided with some IT, some systems also, then some software. So, but we have given the timeline for establishment, but in future, every college will be having laboratory, a language laboratory. Because as per new regulation, without knowing Tibetan language, the student can apply for SowaRigpa and get joined in BSRMS course. So during the first year, those students will be trained properly to read and understand the Tibetan and Boti languages. Then clinical skill laboratory. In future, actually very difficult to handle the patients. Some ethical issues may come. So in Ayurveda Siddha and Unani, we already instructed every institution to establish clinical simulation lab. That is department based. We prescribed nearly 40 simulators and mannequins for Ayurveda Siddha and Unani. But SowaRigpa, very soon we are going to implement. But now some preliminary setup should be there in all SowaRigpa institution to provide clinical training, clinical skill laboratory to get trained in pulse reading and all. Then Materia Medica practical laboratory, teaching pharmacy, quality testing laboratory. We have to view seriously regarding the establishment of quality testing laboratory. We are preparing many medicines, but we are not aware of the quality or safety of the medicines. So you have to train a little bit in that aspect also. Then anatomy practical laboratory should be attached with a dissection hall. Now the dissection is not going on in SowaRigpa institutions, but in Ayurveda Siddha and Unani, dissection classes are going on with dead bodies. No? So in future, we have to establish. Then physiology practical laboratory, pathology practical laboratory, Materia Medica museum also essential for every SowaRigpa colleges. So, then hospital side, previously there was no clinical departments because OPD maintained by all institutions, male OPD and female OPD. But as per new regulation, you have to establish 4 clinical departments. Without these clinical departments, we cannot think about the establishment of PG courses. So clinical departments are very much needed. General medicine, external therapy and surgery, pediatrics and gynecology, clinical psychology and toxicology. Then clinical laboratory, we prescribed minimum requirements for clinical laboratory. So every institute has to establish. Then for higher investigations, like imaging studies and pathological studies, you can have a tie-up with other reputed laboratories, NABL accredited laboratories. Then external therapy and minor operation theatre. So in the new regulation, we made the requirements for minor operation theatre also. You have to perform minor surgical procedures as per SowaRigpa concepts. You have to do. Because these are the areas we have to strengthen. Because we have abundant number of literatures, then abundant number of experts also. So we have to improvise, we have to strengthen that area. Then specialty clinic, now we are insisting only 4 OPDs. If it is necessary, you can establish specialty clinic also under those 4 clinical departments. For example, general medicine, you can establish a specialty OP for diabetes or hypertension or something like that. Gynecology and obstetrics department, you can establish infertility specialty OPD. Like this, based on your requirement, based on the requirement of the college, they can establish a specialty clinic also. We made provision. Then a rating of SowaRigpa Medical Institution, already I mentioned. I developed key areas, 35 key areas. Then I fixed the assessment criteria also, then rating criteria also, then score. If the institution is scoring 81 to 100, that institute will be graded A. Then 51 to 80 B grade and up to 50 C grade. So very soon we are going to implement in SowaRigpa also. Then other essentialities in future, subject related textbook. Now many reference books are there for every subject. So I want to create some textbook subject wise. This is also very much needed. Then practical and clinical record format in common. Now every college is following different format. I want to make it as a uniform pattern that should be followed by the all SowaRigpa colleges in a uniform pattern. So I want to develop some common format, practical or clinical record format, and similarly logbook format also. Practical record or clinical record is something different from logbook. Logbook means you are going to document every activity, which includes theory activity, practical activity, experiential learning activity, whatever it may be. Every day the student has to record their activities in the logbook. So I want to develop a common format for logbook also. With the help of SowaRigpa teaching faculties, definitely in future I will prepare the common format. Then development of subject related teaching tools, because we are handling different pattern of subjects. So based on the subjects, we have to develop the teaching tools also. Then research publications, already I insisted in the inaugural speech. Then PG courses, we are going to think about PG courses also. Then 7th point is very much needed. Visiting ASU medical institutions, because SowaRigpa teaching faculty and students, they have to visit other ISM institutions, Ayurveda, Siddha and Unani, because these systems are already developed, similar to modern medicine. So you have to visit other institutions also, Ayurveda, then only you will get some idea how to incorporate all such developments in SowaRigpa And sometimes you may get trained in other institutions also in that particular clinical conditions or clinical simulators or clinical settings. So you have to visit. Then my suggestion is whenever you are organizing any seminar or conferences, you have to provide a special session for other streams, Ayurveda, Siddha and Unani. Hereafter, you have to invite a resource person from Ayurveda, Siddha and Unani for their presentation, so that you can easily understand what are the things are going in parallel in other medical systems. So if you want, I will suggest the resource person also from Ayurveda, Siddha and Unani. So hereafter, sir, hereafter you have to provide one separate session for Ayurveda, Siddha and Unani. In whenever you are conducting any seminar or conferences. Okay. Then I already insisted Ayurveda, Siddha and Unani. Whenever they are conducting any conference, they will provide a space for Sowa-Rigpa also. So exchange of knowledge and experience is very, very important. Because we are talking about the integration of medical system always. Wow. Integration means many people are thinking that it has to be integrated only with modern medicine. It is not like that. Integration means first we have to develop integration among Ayush systems first. Then we can think about the integration with modern medicine. But integration means there is no definite definition regarding integration. Where to integrate, then to whom we have to integrate. There is no definition. At least we have to start from Ayush medical systems. Integration does not mean we have to give all medicines to a single patient. So a patient should be given Ayurveda, Siddha, Unani, modern medicine. It is not like that. Integration means all experts should sit together and discuss which one is better for that particular patient. Sometimes Ayurveda medicine may be given internally and Siddha medicine will be given externally. Sometimes the SowaRigpa medicine can be given externally, Unani medicine can be given internally. Likewise, we have to decide. We have to decide a protocol also, integrated clinical protocol. Because in future, after 10 years, you write it down right now, integration will be an essential thing in near future. So we have to start that exercise right from today. Then we should collaborate with all medical systems. Then only we could expect the developments in SowaRigpa. Then standard terminologies, in the inaugural speech I already told, we are going to start that exercise also, development of standard terminologies in SowaRigpa. So it is essential for proper documentation at global level. So with all this presentation, I conclude my speech because only 1 hour is given to me. Very sharply, 12 o'clock, I finished my speech. Okay. Then any doubt you can ask me. Academic transcript. Huh. Oh, I forget to. Yes. Recently we developed, thank you Tashideva sir for reminding me. Recently we published the academic transcript for SowaRigpa. You can able to see on our portal also academic transcript, because many times the BSRMS graduates going to foreign countries, then in that particular country you will be asked the academic transcript, then subject wise how many hours you undergone for the training and teaching and training. So all such informations will be collectively given in the academic transcript. So we developed for all 4 systems.
So research publication to conduct clinical research is like, they cost are huge, right? They are very expensive. So will we get some fund from the Ayush if we propose?
Actually, NCISM is not a funding agency, it's a regulatory body. But we need not go for any extensive research. Within your limitation, within your facility, you can do minor things. It is okay. In the starting period, it is okay. Then what we are doing in Ayurveda, Siddha and Unani, we started providing publication grant also. If your article is published in indexed journal, whatever you paid, the publication fee or consultation fee, entire amount you can reimburse from NCISM. So far we provided the fund for the 69 researchers in Ayurveda side and 14 in Siddha side and 4 Unani side. So in future you can also avail. You can reimburse the entire amount. Because some indexed journal they need 6,000 rupees, 10,000 rupees, sometimes 1 lakh. So amount does not matter. Our ultimate aim is our research articles should be published in indexed journal and it should be cited by thousands of citations. Then only it will reach nook and corner of scientific community and world community. It is actually we are, by providing the publication grant, the basic intention we are going to promote the ISM system worldwide. So in future, if publications are there, I can extend that support to SowaRigpa also, publication grant. But a research grant, it is available from Ministry of Ayush. Ministry of Ayush, they can fund. Then DST, Department of Science and Technology, ICMR, then CSIR, many funding agencies are there. But NCISM is not a funding agency, a regulatory body.
Thank you, sir. My question is, what are the challenges we should face when we conduct research facility in our university in future? Research facility, regarding research facility in a broader way, like we don't have we have the basic research these days in SowaRigpa, not in broader way compared to Ayush and modern medicine. So what are the challenges we have to face?
We have to establish that RIC in every institution. Then you have to constitute a committee in every institution, a research committee or research review committee, something like that. Then already I told, no, you need not go for major research projects. Hospital facility is there. Daily you are attending OPD or IPD. You just document. Then case series or even now a single case study you can publish. Previously it is not possible. Now it is possible. So you start from the minor things first. Then once if you develop proper the research ecosystem, first we have to promote the research aptitude among the students first, among the students as well as among the teaching faculties. Then in future you can develop a research ecosystem with all facilities and all. Then quality testing laboratory is there, then materia medica laboratory is there, physiology laboratory. So subject related minor research work you can do. Then the same thing, once you arrive the data, immediately you publish in the journal. So there is no, absolutely there is no challenge. We have to change our mindset. How to utilize the existing facility for research purpose. We have to think. For that purpose, every institute has to constitute some committee. Then the students should put forward their research proposal to that committee. Then the committee will decide what sort of facilities to be provided for that student or for that particular proposal. So likewise, you start from the minor things. Then if it goes on in a very positive way, within 4 years or 5 years, you can establish a very good research facility in every institution. There is no restriction. It is up to the institution only. up to the interest of the teaching faculties and students. Because again and again I am telling, without research we cannot improvise our system globally. Because everywhere you go, they will ask for data. Then they will ask for some documentation, documented material. Because we have to establish our science only with evidences. Even in anatomy practical hall also you can do research. Pathology, for example, you are going to attend diabetes patients, for example, 6 months time period. You are going to assess the pulse of or 50 diabetic patients. This is enough. Where the problem comes, fund problem comes, no. So you are going to analyze the pulse of 50 diabetes patients. Then you document before the treatment and after the treatment what had happened. You produce this data and publish in a journal. This is called research. Or you can do literary research also. So, understand?
One concern is that we have been doing that, like, you know, we are taking the baby step and we are publishing case study, case series and everything. But then when we, like, you know, present in the seminars in the international level or national levels, right? So, like scientists, they ask for like robust, like, you know, very extensive study, like randomized clinical trial. And for that, it's like cost a huge fund. That's why I'm wondering. And my second question is, I'm sorry for my ignorant question if it doesn't pertain to your job area. But I'm wondering, like, you know, why there is no research council in Ayush, because there is a research council for Ayurveda, Siddha, and Unani, like, you know. So
It is coming under Ministry of Ayush. It is not our part actually. But you start, actually you have to start some minor research work. And you start publishing all such details in the reputed journals. Then based on the pilot study, you can go for major study. Already I spelled many funding agencies. No, with the result of minor studies or pilot studies, you can go for major projects. Without any pilot study, you cannot apply anywhere. That is why I am insisting you have to start with minor work first.
Now, our first session will stop here, and there's a important lecture next session. Therefore, thank you, Dr. Jagannathan, for giving such a wonderful, interesting, and valuable talk. Thank you very much.